voice and focus on those high priority concepts, the clinical judgment questions that you have to get right.
This is
So
right.
here's what we're diving into. We've got 5 super critical areas you are for sure gonna see. We'll start with first response stuff like burns and shock. Then we'll get into some gnarly musculoskeletal emergencies. After that, we are going to clear up the confusion between 2 key spinal cord issues, do a rapid fire neural review, and wrap it all up with how to spot and jump on sepsis. Let's get into it. Okay, let's kick things off with those situations where what you do first can literally be the difference between life and death. You know, when you see a question about burns on an exam, your brain needs to immediately flash on 2 major threats, the airway and fluid loss. You are gonna see this kind of scenario all the time on exams, and for good reason. It's testing if you can spot a massive emergency that's kind of hiding in plain sight. The clues are subtle, but they are everything. So what's the very first thing you have to deal with? The answer is always airway. That hoarseness, or if you see any soot around the mouth or singed nose hairs, those are giant flashing red flags. They're screaming that the airway is swelling up and could slam shut. In that moment, nothing else matters. Not the burn, not the pain. You have to secure that airway, period. So what's the other huge threat with burns? It's hypovolemic shock. See, with big burns, the blood vessels get super leaky. A ton of fluid just pours out of the bloodstream and into the tissues. And that is exactly what puts these patients at such a huge risk for shock. Next up, let's talk about broken bones. Now, exam questions are not just gonna ask you to spot a fracture. Nope. They're gonna test if you can see the limb-threatening complications that can pop up after. And there's one in particular you absolutely have to know. These 6 Ps, you need to know them by heart. This is your go-to assessment, your toolkit for any patient in a cast, an immobilizer, or with a major injury to a limb. It's how you catch a disaster before it happens. Now, listen closely to this. When a patient says this, when their pain is getting worse, even after you've given them strong pain meds, every single alarm bell in your head should be going off. This is not normal pain. This is the #1 sign of compartment syndrome, and that is a true surgical emergency. And this right here is the absolute key takeaway. Do not wait for pulselessness. Seriously, if you wait until the pulse is gone, it's often too late and the damage is done. This specific kind of pain, the pain that just keeps climbing no matter what you do, that is your signal to act fast and save that limb. All right, let's tackle 2 high-level concepts that trip up so many students on exams. Because yeah, they both involve spinal cord injuries and they both mess with vital signs. We're talking about autonomic dysreflexia and neurogenic shock. Let's make this crystal clear. So how do you tell them apart in a flash? Just look at the blood pressure. They are polar opposites.